Cervical cancer is a significant public health problem globally, with an estimated 570,000 new cases and 311,000 deaths annually. However, cervical cancer is a preventable disease, and early detection through regular screening with pap smear tests can greatly increase the chances of successful treatment. In this video, we will discuss the importance of pap smear and cervical cancer screening, including its benefits, limitations, and recommendations for women. Pap smear is a test used to detect abnormal cells in the cervix that could potentially develop into cervical cancer. During the test, a healthcare provider collects a sample of cells from the cervix and sends it to a laboratory for examination under a microscope. The pap test is not a diagnostic test for cervical cancer, but it can detect early changes in cervical cells, allowing for early intervention and treatment. The pap smear is a simple, quick, and relatively painless test that can be performed during a routine pelvic exam. Screening for cervical cancer with pap smears has been shown to reduce the incidence and mortality rates of cervical cancer. According to the American Cancer Society, regular pap smear screening can detect 90% of cervical cancer cases. Furthermore, early detection through pap smear can increase the chances of successful treatment and improve the quality of life for women affected by the disease. Despite the benefits of pap smear screening, there are limitations to this method of detection. Pap smears can generate false negative or false positive results, leading to unnecessary anxiety or misdiagnoses. False negatives occur when the test fails to detect abnormal cells, and false positives occur when the test indicates the presence of abnormal cells when there are none. Additionally, the pap smear does not test for all types of cervical cancer, such as adenocarcinoma, which is becoming more common. Currently, there are new and emerging technologies that can be used in conjunction with or as an alternative to pap smear screening. The most notable of these is the human papillomavirus, HPV, test, which can detect the presence of the virus that causes most cases of cervical cancer. The HPV test can identify women at risk of developing cervical cancer earlier than the pap smear. It is important for women to adhere to the recommended screening guidelines for cervical cancer, which vary from country to country. In conclusion, pap smear and cervical cancer screening is a crucial tool in the prevention and early detection of cervical cancer. Regular screening can detect abnormalities in cervical cells, leading to earlier treatment and improved outcomes for women. While there are limitations to pap smear testing, emerging technologies such as HPV testing can improve detection rates and reduce the risk of false negatives. Women should adhere to the recommended screening guidelines and discuss any concerns or questions with their healthcare provider. Please subscribe to the channel.